Let me paint you a picture that might feel closer to home than you expect. You are 74 years old. You wake up most mornings feeling steady. You sleep reasonably well. Your energy is not what it was at 40, but it is good enough to enjoy your day. You have your routines, your independence, your quiet sense of control over your life. Then one day you go in for what seems like nothing more than a routine checkup. Just another annual visit. Nothing urgent, nothing bothering you. Your doctor flips through your chart, pauses for a second, and says something that sounds harmless. Let us run a few extra tests just to be safe. It sounds responsible. It sounds proactive. It sounds like good medicine. But 6 weeks later, you are sitting in a specialist office, hearing words you never expected to hear. Not because you felt sick, not because something was wrong, but because those just-to-be-safe tests found something. And that something starts a chain reaction. More tests, more appointments, more decisions, more pressure, and suddenly the life you were quietly enjoying begins to shift in ways you never planned. I am Dr. William Bennet, and on this channel, my mission is simple. I help adults over 60 understand what the research actually says about their health in plain, clear language. What I'm about to share with you today is not based on opinion. It comes from years of studying medical evidence and observing what happens when the healthcare system moves forward, without slowing down to consider the full picture. Here is the truth most people never hear during a short appointment. After the age of 70, some routine medical tests can do more harm than good. Not because doctors are careless, not because medicine is failing, but because the balance between risk and benefit changes dramatically with age. And most of the time, no one is doing that math with you in the room. Today, I will walk you through 5 common medical checkups that deserve a second thought after 70. I will explain why the equation changes. I will share real patterns seen in patients. And I will give you a set of questions that can completely transform your next medical visit. Stay with me all the way through because the third one often surprises people. And the fifth is something many have never even heard of until it is too late. Before we go further, I want to know where you are watching from. Tell me your city or your country. I read every comment and it helps me understand who I am speaking to. Now, before we break down the 5 checkups, you need one key concept. Without it, nothing else will fully click. I call it the longevity lens. When you are 50, screening tests make perfect sense. You detect something early, you treat it, and you potentially gain decades of healthy life. The math is simple, the benefit is clear. But after 73, critical things change. First, many conditions found through screening grow so slowly they will never impact your life. You are far more likely to live with them than suffer from them. Second, your body does not recover from interventions the same way it used to. What is minor at 55 can become life-altering at 75. Third, there is something called the cascade effect. One test leads to another, then another, until a healthy person is suddenly navigating a complex medical situation that began with something that may not have needed attention at all. Keep that lens in mind as we move forward because it will change how you see everything that follows. Checkup number 1. Routine colonoscopy after age 75. Let me tell you about a situation that reflects what happens more often than people realize. A woman in her late 70s, active, independent. No symptoms, no family history of colon cancer, had already done everything right earlier in life. Her previous screenings were completely clear. Then, during a routine visit, she was told it was time for another colonoscopy. She hesitated but agreed. What happened next had nothing to do with cancer. The preparation process alone placed stress on her body: severe dehydration, electrolyte, imbalance, confusion, weakness. Instead of preventing disease, it led to an emergency situation. And here is where the conversation becomes important. For individuals over 75 with no symptoms and no significant risk factors, routine colonoscopy is no longer universally recommended. The reason is simple. The potential harm begins to outweigh the benefit. Complications such as bowel perforation, while uncommon, become far more serious with age. Recovery becomes longer. Outcomes become more uncertain. At the same time, many colon cancers detected at this stage of life are slow growing. They may never become clinically significant within a person's remaining years. So what is the alternative? Less invasive stool-based tests done at regular intervals. These can detect warning signs without exposing the body to procedural risks. But here is the key distinction. If you have symptoms such as blood in the stool, unexplained changes in bowel habits, or persistent discomfort, the situation changes completely. That is when direct evaluation becomes necessary. Now let us move to checkup number 2. Aggressive cancer screening in low-risk individuals. This is where nuance matters. Screening has saved lives. There is no question about that. But after 75, the issue is not detection, it is overdiagnosis. Modern imaging is extremely sensitive. It can detect abnormalities that may never progress into harmful disease. These are conditions you would live with, not die from. But once they are identified, the system moves forward. Biopsies, treatments, interventions. Even when the condition itself may never have caused harm, many individuals go through treatment and experience side effects that reduce quality of life without gaining meaningful extension of life. This is not theory. This pattern is well documented. So what should you do? Shift the conversation. Instead of asking, "Should I test?" Ask, "If something is found, what will we realistically do about it at my age?" That single question changes everything, because it forces a focus on outcomes, not just detection, and that is where better decisions begin. Checkup number 3. Routine cardiac stress testing without symptoms. This one sounds logical at first glance. You are getting older, so checking your heart seems like a smart preventive step. You walk on a treadmill or receive medication to simulate stress while your heart is monitored. It feels responsible. But here is the hidden issue. In people without symptoms, these tests produce a high rate of false positives. That means the test suggests a problem when none actually exists, and medicine does not ignore abnormal results. It escalates. The next step often involves a cardiac catheterization, a procedure where a tube is inserted into your blood vessels and guided to the heart. This is not a minor step. It carries risks including bleeding vessel injury and in rare cases triggering the very events it aims to prevent. Then comes another layer. If a blockage is found, which is common with aging, you may receive a stent. However, large clinical trials have shown that for stable conditions, stents do not necessarily reduce heart attacks or extend life compared to medication and lifestyle changes. So a person who felt completely fine may go through a cascade of procedures without improving their long-term outcome. The better approach: focus on risk factors, blood pressure, cholesterol, blood sugar, physical activity, sleep. These have a far greater impact on heart health than testing without symptoms. Now, checkup number 4, bone density screening followed by automatic medication. Bone health is important. There is no debate about that. But the issue lies in what happens after the scan. A low bone density result often leads immediately to long-term medication. What is less discussed are the potential long-term side effects, including rare but serious fractures and jaw complications. Meanwhile, the most powerful strategy to prevent fractures is not medication, it is fall prevention. Improving balance, strength training, removing hazards at home, regular vision checks, proper nutrition. These interventions reduce real-world risk more effectively and without side effects. So before starting medication, ask, what is my actual fracture risk? And how much will this treatment reduce it compared to non-drug approaches? That is the level of clarity you deserve. Checkup number 5. Carotid artery, ultrasound in people without symptoms. This is one of the least discussed yet most quietly impactful screenings in modern medicine, and that is exactly why it deserves your full attention. At first glance, the idea seems simple and logical. The carotid arteries are the main blood vessels in your neck that carry oxygen-rich blood to your brain. If there is a narrowing or blockage, it sounds reasonable to find it early and fix it before it causes a stroke. That is the promise. But here is where the reality becomes more complex. Many adults over the age of 70 have some degree of narrowing in these arteries. It is part of the natural aging process. In most cases, this narrowing develops slowly over many years, remains stable, and never causes symptoms. You can live your entire life with it without ever knowing it is there. The problem begins when we go looking for it without a clear reason. Because once it is found, it becomes very difficult for the system to ignore it. And that is where the cascade begins. You go in for a routine ultrasound. You feel fine. You have no symptoms, no warning signs. The scan detects a moderate narrowing. Now suddenly you are referred to a specialist. More imaging is ordered. More opinions are given. And eventually the conversation shifts toward intervention. The most common procedure used in this situation is a surgery designed to remove the plaque from the artery. On paper, it sounds preventive. In reality, it carries its own risks. The procedure itself has a measurable chance of causing a stroke during or shortly after the operation. And here is the key point that changes everything. You may be taking on that risk to fix something that was never going to harm you in the first place. This is not speculation. This is supported by large-scale clinical data. In people without symptoms, the benefit of finding and surgically treating these blockages does not consistently outweigh the risk of the procedure. That is why major medical guidelines advise against routine screening in asymptomatic individuals. So what should you focus on instead? This is where the conversation becomes empowering, because the most effective ways to reduce stroke risk are not hidden inside a scan. They are within your daily control. Managing blood pressure is the single most powerful step you can take. Keeping blood sugar stable, especially if you have diabetes. Staying physically active, even a simple daily walk, has measurable impact. Avoiding smoking or quitting if you currently smoke. Monitoring heart rhythm conditions such as irregular heartbeat. These actions directly influence your real risk, not theoretical risk, not incidental findings, real outcomes. And here is something most people never hear. A clean scan does not guarantee protection, and an abnormal scan does not guarantee danger. What matters is how your body functions day to day, not just what appears on an image. If you experience symptoms even briefly that suggest a neurological event such as sudden weakness, facial drooping vision, changes, or difficulty speaking, that is a completely different situation that requires immediate evaluation. But without those signs, routine screening can create more problems than it solves. This is where understanding the difference between detection and impact becomes critical, because not everything that can be found needs to be fixed, and not everything that looks abnormal is dangerous. That awareness alone can protect you from unnecessary risk. I want to close this conversation by shifting your perspective in a way that may change how you approach your health for the rest of your life. There are two very different types of medicine. One is focused on finding as many abnormalities as possible. The other is focused on helping you live well for as long as possible. After the age of 70, those two paths do not always lead in the same direction, and that is where clarity becomes essential. Because more testing does not automatically mean better health. More information does not always lead to better outcomes. And more intervention does not always extend life in a meaningful way. In fact, in many cases, it can do the opposite. It can introduce stress complications and limitations that were never part of your life before. So the question you need to begin asking is not, what can we find? The question is, what actually helps me live better? What preserves my independence? What keeps my energy stable? What allows me to continue doing the things that matter most to me? That is the definition of real health at this stage of life. And achieving that requires a different mindset. It requires you to become an active participant in your care, not a passive recipient. It means asking better questions. It means slowing the process down when needed. It means understanding that saying "not now" or "let us monitor this" is not neglect. It is often wisdom. And here is something I want you to remember clearly. A good physician will not feel challenged by your questions. A good physician will respect them, because thoughtful questions lead to better decisions, and better decisions lead to better outcomes. You are not being difficult when you ask for clarity. You are being responsible. You are protecting your future. Now let us revisit the 5-question framework, because this is your practical tool moving forward. Every time a test or procedure is suggested, pause and ask, what is the likelihood this test finds something that is not actually dangerous? If something is found, what are the realistic next steps for someone my age? What are the risks of those next steps, not just the benefits? Is monitoring a safe and reasonable alternative? And what lifestyle or non-invasive strategies could provide equal or greater benefit? These questions bring balance back into the conversation. They shift the focus from automatic action to intentional care. And that shift is where better outcomes begin. Because the goal is not to avoid medicine. The goal is to use it wisely, to use it when it truly adds value, and to step back when it does not. You have the right to a healthcare experience that reflects your priorities. Not just protocols, not just routines, not just assumptions based on age, but your actual life, your goals, your definition of well-being. If this message gave you a new way to think about your health, I encourage you to take the next step. Subscribe to my channel. Every week, I share clear evidence-based insights designed to help you make informed, confident decisions about your health. And before you leave, I would really like to hear from you. Have you ever gone in for a routine test and found yourself on a path you did not expect? Your experience could be exactly what someone else needs to hear before making their next decision. Take care of yourself, and I will see you in the next video.